Hello, good evening. I'm Dr. Nilesh Balkawade, Clinical Head Oasis Fertility, Pune. Today, I'm going to talk about high DFI and how we can go about treating this high DFI. DFI or DNA fragmentation index is calculated in sperms, the semen sample, to check how much is the fragility or the fragmentation rate of DNA in the sperms. Friends, sometimes we don't get any cause of infertility, and the all other parameters are normal, but there can be slight issues with the sperm count, motility, or morphology, and these are not so much severe. But in spite of that, the couple is not able to conceive. Sometimes couple is able to conceive, but we can get recurrent pregnancy losses because of high DNA fragmentation. So many of the reasons can be found out in high DNA fragmentation. The success rates of IUI, IVF can also decrease with high DFI or high DNA fragmentation. Therefore, it's very important to know which patients we need to check for high DFI. There, patients or couples in whom the husband have a low sperm count, low sperm motility, or low sperm morphology. These are the couples whom we have to definitely check for high DFI. If the count, motility, and morphology is severely low, that is, the count is below 10 million, motility below 20%, and morphology below 4%. All these cases probably are high risk, and therefore we need to do a high DNA fragmentation index in such patients. Couples in whom there is a history of unexplained infertility and there is no cause found of infertility. These are also couples where we can check for DNA fragmentation index. Couples in whom they have done IUI, those have failed, also an indication. IVF failures can also do DNA fragmentation index before they undertake any previous cycle in the any next cycle. And couples in whom there is a history of recurrent pregnancy losses, the pregnancy losses have been early miscarriages, before 12 weeks, first trimester miscarriage. These are the high chances of having a high DNA fragmentation index. Therefore, these are the patients in whom we can take DNA fragmentation index measurement tests. Uh, how do we measure this? So there are certain specific criteria to measure DNA fragmentation index, and we should not be doing this such an important test in a local labs. There are certain labs which do sperm DFI by sperm chromatin dispersion technique, SCD. This is a very crude technique, and it is a subject dependent technique and or a observer dependent technique. Sometimes the staining can be different, and different observer can draw different conclusions, and therefore it's not an objective assessment. I would personally recommend a test which is done by immunoflow cytometry techniques, where sperm chromatin structured assay, that is SCSA, or tunnel assay, TUNEL. Tunnel assays are used for assessment, where it's a objective assessment, and the sperms which are having a problem are stained in a different color and can be assessed on immunoflow cytometric techniques. This is a very precise test to assess the sperm DFI. How to collect sample for this is also important. So the sample should not be too old, and the abstinence period should not be too long, and this abstinence period should not be too short, as less than 24 hours. The abstinence period ideally for sperm DFI should be around 48 hours. Not less, not more is better. That time is considered as an ideal time for giving a sample, so that the DNA fragmentation is less. There are less dead sperms because of more abstinence, and the sperm count is sufficient enough to give results. Now, these collected samples, usually, if you are doing this immunoflow cytometric techniques at your own place, then it's fine. But sometimes the labs are far away, and therefore you have to freeze these samples and then send the samples for checking. Then you arrive at a precise diagnosis of whether what is the DNA fragmentation index of that particular patient. For all practical purposes, if we go by these two techniques, DNA fragmentation index should be typically less than 25%. That means out of the 100 sperms analyzed, less than 25% should have a fragmented DNA. If it is more than 25%, it indicates that the patient is high risk for any problems associated with fertility or miscarriages. or male factor infertility. If the DNA fragmentation index is more than 50%, these are considered extremely high risk patients, and in such patients, we should wait, try to find the cause of high DFI, and then only go on treatment of these patients. If we consider the causes of high DFI, it can be related to any anatomical problems such as varicocele, any physiological problems, or maybe change in the body structure, like lifestyle, where the smoking addictions also play an important role in high DNA fragmentation. So if the testis is exposed to certain situations or certain scenarios where the testicular temperature might be high, the testicular cells are exposed to certain um, mm, substances which are causing problems, uh, cigarette smoke or nicotine, or maybe some pollutants, some chemicals, like workers in chemical companies, or workers in atomic energy plants, or workers in X-ray departments are high chances of there are high chances of having high DNA fragmentation in such couples or in such husbands. Therefore, it's imperative to ask the occupational history, to assess the lifestyle history, to check for any problems associated. And in such scenarios, also, we can ask the patient to go for a DNA fragmentation index. Now, what to do if the DNA fragmentation index is high? If the DNA fragmentation index is high, that is more than 50%, it's a very critical situation where the chances of a natural pregnancy might go down, or if the chances of miscarriage can be very, very high. Even there can be problems of miscarriages in such pregnancies. So it's definitely useful to wait for 3 months in such patients, give antioxidant therapy, introduce lifestyle changes, whatever is causing problem. If there is a varicocele, go and treat that varicocele. If it is an occupational exposure, try to decrease the occupational exposure. And then after 3 months or 4 months of intensive therapy and antioxidants, along with reduction of that risk factor which is causing, then these patients will definitely, show certain signs of reduced DFI. If the DFI is still high, we'll see what to do. Now, those patients who have a DNA fragmentation index between 25 to 50%, these are definitely again at a risk, but the risk is slightly lower. In such patients, also antioxidant therapy is useful, lifestyle therapy is useful, and they can try naturally even in such scenario. And if they are going for IUI, IVF, it is preferable that their DNA fragmentation comes down and you do a second DNA fragmentation index testing, and then the patients are taken up for this any elective procedure like IUI or IVF. In case after intensive therapy, after lifestyle changes, after reducing the cause of high DNA fragmentation, still the DNA fragmentation remains on a higher side because of chronic reasons, then in such scenarios, it's imperative that we use some sperm selection techniques for selecting good sperms which are less damaged. So in IUI cases, we can use magnetic cell sorting, which is considered as giving a better volume of sperms, because the rest of the techniques of sperm selection might not give you the good sperm volume for IUI. But in IUI, we can the selection may not be that efficient. However, if we go for a sperm selection technique, then IVF would be better for such patients where those who have high DNA fragmentation index, where we can use magnetic cell sorting, microfluidics, electrophoretic techniques, uh, PIXI, that is physiological ICSI, and testicular sperm aspiration as different techniques of sperm selection, so that we can get less damaged sperms for IVF or ICSI. Friends, this less damaged sperms will give you structurally better and morphologically better embryos, and also a more euploidy rate of the embryos, which will improve the success rates of IVF or ICSI. So it's very important for us to understand that DNA fragmentation index can play a very important role in a person's life, in a man's life, and they can take a consultation and try to improve that, by normal means, physiological means, lifestyle changes, medicines. But if it's not so, then they may have to undertake to find the cause of that problem, and sometimes surgery needed for varicocele. Sometimes you can go for sperm selection techniques, and IVF as another option of therapy. So that's all for me for now for sperm selection for high DNA fragmentation index or high DFI cases. Hope you find this video useful. If you like this video, please share and with those who need this, and do connect with us for any of your queries. We are displaying our numbers, the helpline numbers below, so that you can connect to us anytime in your busy schedules on phone, or you can drop in at any of our centers of Oasis Fertility all across India and in Pune at Wakad and Kharadi. So that's our helpline number. So thank you so much.